刘主任，您可以开始了。
好的，大家早上好。
Good morning, everyone.
尊敬的巴斯道尔夫教授，问好。
I give my warm greetings to Dr. Bosdorf,
然后也向我的老朋友，布洛格尼兹，还有其他的新的同道们问好。
and also greetings to my old friend, Dr. Bolognese, and everyone else.
感谢大会给我分配的这个题目，是Chiari外科的一些术后的并发症。
Thank you for the invitation again. I'm very honored and happy to be here and share with you my experience.
这个话题听起来是一个简单而又复杂，然后明确而又富有争议的一个话题。
This topic in post-operative complications of Chiari malformation is, well, somehow simple and somehow very complex. It's a controversial topic.
我争取把我们所经历的一些东西，简单的化的做一个汇报，然后要有问题的话，我们再细致的再讨论。
I'll try my best to share with you my experience in this field and in this topic. And if there is any questions, we can discuss later.
我们知道大概腔外外科的手术方式主要有 PFD、PFDD、PF2，还有我们现在所做的这个陈大齿重建术。
These are the main surgical procedures for Chiari malformation, posterior fossa decompression, PFD, and posterior fossa reconstruction, and also cisterna magna reconstruction and cerebellar tonsil resections.
我们中心专门把这个陈大齿重建术有微创化的一个。然后我们一块命名为MIST， 这是我们和 Mr. Blognese 一块来命名的。
In our hospital, we improved the surgical procedure in cisterna magna reconstruction, and we call it together with Dr. Bolognese, we improved this surgical procedure and call it MIST, i.e. minimally invasive subpial tonsillectomy.
主要特点就是后面4项。
And these listed are the features of this surgical procedure.
那么，回顾一下的话，这个术后的并发症主要有下列这么多项目，包括接口积液、术后发热、无效、下垂、粘连、扭转、系统器等等。
In this slide, listed are the main post-operative complications after Chiari malformation surgery, including CSF leakage, fever, and cerebelloptosis, or inadequate deflation of the syrinx. And also there could be adhesion in the surgical area and medullary traction, and also sometimes patient can develop respiratory failure or hypoventilation.
我们的病理资料当中也有一些是其他医生做的手术，所以我们对每一种手术方式所并发症出现的几率呢，我们不好做一些，因为我们是临床大夫，没有办法去试着给病人来硬是安排或者选择不同的手术方式。我们近几年来只做 MIST， 以后可能会期待这个 International Database Project 给我们带来一些答案。
Most of our patients have received surgeries in other hospitals before the CS, and we do not have the exact statistical data on complication relationship with specific surgical procedure. And on the other hand, in our hospital, as clinical physicians, we mainly perform MIST, and it's really hard for us to compare to other surgical procedures. And regarding to this problem, we really hope that the International Database Project can give us some answers in the future.
下面通过一些我们的病例来具体讲解一些并发症和治疗策略。
Now we're going to see some cases and some complications and their management.
这是有关于脑揭露，然后它的原因可能就是硬膜缝合不严密，这是一个技术问题。
The first one is CSF leakage, and the cause of CSF leakage mainly is because of a dural suture is not quite tight, and this is a suture technique problem.
那么这是一个病例，能看到的话，这是一个 PFDD 的，然后它修补完了之后，很大的一个枕下积液。那么我们再把这些脂肪再做一个修补和填塞之后呢，然后又做了分流，所以它这个结构就变好。
In this patient, we can see the first image on the left is before the surgery, and the second image, the image in the middle shows after PFDD. There's a cyst in the cervical area, and there's no deflation of the syrinx. So we did repairment and shot, which is shown at the arrow, and we can see that the syrinx has deflated significantly.
那么这是另外一个减压术后不奏效，然后术后空洞虽然缩小，但是又出现这么大一个积液。这样的话，我们把下疝做一个 MIST 之后，这个硬膜重新再进行修补。
And this is another case of CSF leakage. However, in this patient, we can see after the surgery, in the second image, it shows a deflation of the syrinx, but there is a CSF leakage. And so in this patient, we performed MIST and also reconstruction of the dura mater. And the third image, it shows after MIST, 1 week after MIST.
这是另外一种，就是术后手术无效或者症状加重，或者需要第二次手术。那么它的原因主要还是直纳室空间不够，粘连、瘢痕增生，还有其他一些问题。
The second is a failure of improvement of the symptoms after surgery. Usually this will require a secondary surgery, and most of the time it's caused by an inadequate cistern magnum reconstruction and foramen magnum region adhesions or hyperplastic scar tissues.
那这个像这个减压手术以后半年它是有效的，但是4年之后瘢痕增生，它就空洞又开始，原来没有空洞了，又出现了空洞。那么我们做了这个 MIST 之后，然后它这个空洞又消失了，这也是一种处理的办法。
In this patient, we can see that before and after the first surgery on the left upper hand, the two images shows that the syrinx deflated after the surgery, and the symptoms improved after the surgery. But 4 years after the first surgery, which was PFD, the patient started to have symptoms again, and he presented with syrinx, and we performed a MIST procedure in this patient. And 6 months after, we can see that before and after the second surgery on the right lower hand, these two images, before and after missed. 6 months later, we can see a very good space of the cisternectum, and also the syrinx has deflated.
那么这是一个也是其他医生做的减压术 PFD， 然后手术之后这个诊大室仍然拥挤，然后我们做了这个 MIST 之后，这个结果就比较好了。
In this patient, in this case, the patient received surgery from the hospital, and after the surgery, in the second image, there's no adequate reconstruction of the cisternectum, and the patient did not, the symptoms did not improve. And after we performed MIST, and we can see that the syrinx deflated on the third image, and also the patient symptoms had improved significantly.
那么这是一个枕大孔区术后 PFDD 之后的一个粘连的这个情况。这是一个粘连之后，我们非常艰难的把这个粘连松解了之后，然后又做了 MIST， 然后又做了这个 duroplasty， 特别扩大了一些，来防止进一步的粘连。那么术后这个病人的吞咽和呼吸状况大为改善。
In this patient, patient received PFDD after the surgery, there were massive adhesion showed in the MRI in the middle image, and the patient experienced dyspnea and dysphagia. So after admitted to our hospital, we tried to remove as much as the adhesion tissues as possible and did a duroplasty. After surgery, the patient symptoms improved significantly.
那么这是另外一大类，它是一种叫后脑下垂。
The next one is cerebellatosis.
这个可能见的都很多，在过去的一些大骨减压疮的这个情况下，会有很多会很常见。
This can be very common, especially when doctors, when surgeons used to remove too many bone tissues for reconstruction of the cisternectum.
还有一种不太常见的就是减压术后可以出现这种延髓的牵拉和扭转。
This can be a very uncommon complication. After the surgery, patient developed medullary traction.
这是一个比较典型的一个病例，病人在减压术后出现了这个脑干延髓向后一个移位。然后病人的呼吸状况和吞咽障碍非常糟糕，然后半年左右才脱离呼吸机，当然不是我们这儿的病人，至今现在这个气管切开还保持气管切开的状态。
This patient received PFD in another hospital, and after the surgery, we can see on the right that there is a posterior deviation of the medulla, and the patient experienced very nasty dysphagia and dyspnea, and he was put on a ventilator for 6 months, and this could be a very serious problem.
还有一种情况就是呼吸衰竭和低通气的这个情
况。Then we have complications like respiratory failure and hypoventilation.
还有一种状况，像这种状况就是减压术后或者是 PFDD 时候，这个术后的瘢痕增生可以造成重新的压迫。
And this is a hyperplasia of scar tissue after surgery, which can and the scar tissue can compress the central nervous system.
那么还有一些特殊的合并症，比如说有一些特殊的合并症，比如合并有栓系的，合并有颅颈不稳的，这样的话，一个是可能会漏治，第二个话可能会增加一些处理上的难度。
And other complications like tether cord with normal cons and cranial cervical instability, these sometimes can be ignored and not being recognized in clinical practice, which can cause a very bad outcome.
像这种圆锥位置正常的这种脊髓栓系，很容易被漏诊。
In a case like patient with tether cord with normal conics, this sometimes can be unrecognized in practice.
像这一类就是一个圆锥位置正常的脊髓中枢紧张的状态。实际上的话，它的这种处理就是把中枢切断就好了。
In this case, the patient conus location is normal, and during surgery, you can see there's a tension of the terminal finale and the terminal filus. I'm sorry. And in this case, we just cut off and release the tension.
那么枕颈不稳的问题的话，如果是做了这个 PFD 的话，或者 PF2 或者 PFDD，有可能会增加枕颈不稳的处理的难度。
And in patient who receive PFD or PFDD, and patient can experience the cranial cervical instability can deteriorate, and which will make it more hard to repair.
像这一例就是做完下疝减压以后，做完 PFD 之后，他这个下疝存在，然后病人症状有加重。我们又在翻修手术的时候，要做这个固定的话，只能采取一个长阶段，甚至没有在指骨的区域上，只能选择经口在环枢的侧髋关节间进行植骨，所以这个手术的难度和操作方式大大增加了。但是病人很好。
And in this patient, after surgery, patient had instability in occipital cervical area. However, in this patient, we have no choice but to perform a long segment internal fixation, and also we performed a transoral. We placed the screw and fixation through oral cavity. In this case, the difficulty of the surgery is significantly high, and complications the rate of complications can be high too. So, however, this patient improved after surgery significantly and ideally.
所以我觉得，怎么来应对和避免这些并发症？我觉得有2句话。第一句话就是说，每一个缺陷也好，每一个并发症也好，针对病人来讲虽然少见，但是每一个病例都是独立的。每一个病人来讲可能都是灾难性的，而对于我们的医生来讲，有些病例可能都是颠覆性的，会让我们的信心和我们的事业都会受挫。
in cases like in patients with severe complications, the way to avoid these complications, in my opinion, is that we need to treat every patient individually, because every patient, their situation can have similarity, but however, for each case, it's different and distinct from others, and sometimes they can be very difficult, and we just need to be confident and work well with our team.
在中国，我们也都中国的大夫，我们做了一些统计，大概现在也倾向于做 PFDD， 然后很多大夫也在做这个小脑百常体下疝切除。
In China, which surgical procedure is preferable is still controversial, and most doctors still prefer PFD or PFDD, and of course, like in our hospital, we prefer MIST.
然后我们更倾向于做这个 MIST。
This is what we prefer in our hospital, to do the MIST procedure.
然后重点就是这个大齿的整形和修复。
And the feature and the key point in this procedure is the reconstruction of the cister magnum.
然后我们从08年和09年之后这5年的时间，我们看到我们的并发症的情况已经发生的是很少，只有过性的一类脑积水和有2例这个短期的这个接口小的这个疾病。
And this is a statistical data in our hospital after 2008, after we started at MIST procedure, and we can see that the complications from 2001 case of hydrocephalus and 2 cases of CSF leakage.
所以我们虽然说是对 MIST 这个手术方式我们很有优势，但是我们也期望以后可能需要前瞻性的多中心对齐对照来检验哪一种术式操作的这个更加的优良，并发症更少。然后
we prefer MIST in our hospital, and however, there are also other surgical procedures regarding Chiari malformation, and we would love to have a multi-center randomized control trial study, and to see which procedure has the less complications and the best outcome.
我们也愿意把我们的病例拿出来，然后共享，然后希望与其他中心的学者一块儿致力于Chiari手术的规范化的研究。
And we are more than happy to share with you our patient data and this international database project, and we would love to work together with doctors from all over the world to devote ourselves into this Chiari malformation.
好，谢谢大家关注，然后预祝大会圆满成功。
Thanks everyone again, and I wish complete success of the meetings. Thank you.